Hi, I am Dr. Mohammed Siraj, Specialist Pediatrician working at Family Star Medical Center, Abu Shagra, Sharjah. I have been practicing pediatrics since almost 25 years, starting from India, then in Saudi Arabia, and now since last 8 years in United Arab Emirates. Today I will be talking about childhood obesity, which is very common worldwide problem. There are broadly two types of obesity. One is childhood obesity and the other is adult onset obesity. The childhood obesity mainly results from increase in both size and number of adipocytes called as fat cell, while adult obesity is mainly due to increase in size of fat cells. This makes childhood onset obesity very difficult to treat as compared to adult obesity. These obese children frequently go on to develop adult obesity with its complications like hypertension, diabetes mellitus, ischemic heart disease, sleep-related problems, behavioral issues, easy fatigability, and in female children, they may go on to develop PCOD, menstrual irregularities, and infertility later on. The main cause for the childhood obesity is faulty feeding habits and sedentary lifestyle. Even though every one of us are aware of this cause, still the childhood obesity is on rise. This I think is mainly because of this increasing recent man-made epidemic called the mall nutrition, where the children are taken to food courts in the mall and given high-calorie junk foods. Also, it's not just the quantity of junk food we are eating, it's the type of calories we are consuming from these junk foods. These junk foods are made tastier by addition of refined sugars and trans fats. Refined sugars are the ones which are present in the chocolate, brownies, pastries, ice creams. These refined sugars have a very high glycemic index, meaning they are very easily absorbed, and this causes very high rise in blood sugar, and to which the body responds by secreting high amount of insulin, which brings down the sugar and makes us more hungry, and then we continue to binge more, and this vicious cycle continues and goes into the development of overweight and then obesity. Second are the trans fats, that is yellow fat, which is solid at room temperature, and these market sold butter, cheese are not good fat. These fats tend to get accumulated in your abdomen, on the waist, and in the coronary arteries. On the top of it, these children have no time or place or area to play, and they tend to become couch potatoes, watching video games with little activity. So we need to be very wary of the situation and correct ourselves. Apart from this, obesity can also be familial or sometimes due to some genetic syndromes or some endocrine diseases, and at times due to the drugs which the children are consuming. Obesity is also common in two groups of babies. One are the babies who are born large at birth. It's called as large for dead babies, particularly infants of diabetic mothers. And second are the babies who are born too small at birth, called as IUGR babies, intrauterine growth retarded babies. These babies after birth are naturally prone to develop more weight as compared to other kids. Thus the parents of these babies should be warned, and so that accordingly proper precautions are taken. These all factors contributing to the obesity can be very early detected by regular growth monitoring and physical checkups by your pediatrician, and then accordingly, depending on the cause, the proper interventions can be taken along with nutritional advice and increased physical activity. It was nice sharing my thoughts with you, and hope this brief information will be of beneficial to you. If you have any queries relating to your health, please visit us at Family Star Medical Center, Abu Shagra, Sharjah, and we will be very happy to serve you. Thank you very much.